So thank you for allowing me to talk today to you and to your viewers. I think when we are talking about sleep, clinicians need to be thinking beyond just sleep disruption and into additional factors of sleep, including things like how often the children are waking up at night, difficulty falling asleep, and how that impacts everybody's day the following day. Are they having irritability? Are parents having difficulty at work, or children having difficulty at school? It's not just this atopic dermatitis with the itch and rash itself, but how it all impacts. We have a couple of validated tools that we used as part of this sub-analysis: the patient-oriented eczema measure or POEM score, and the dermatitis family impact questionnaire. And those are validated testing scores to look and assess for patients their sleep quality and how their eczema is impacting their lives. It looks at both the patient themselves with a POEM score and then the family impact with a DFI. This is a way to allow the clinicians themselves to have more of a well-rounded view on and objective data on how the eczema is impacting their lives. I see eczema causing sleep disruption all the time in my clinic. We are having all of these discussions in clinic about how much they're sleeping, how often they're having nighttime awakenings. And I'm frequently talking with parents about how disruptive it is, both for school and behavior the next day, and on the parents themselves and their quality of life. So it is a very important aspect of quality of life and day-to-day living. Absolutely. So the new findings demonstrate clinically meaningful improvements in sleep. That is being measured by those scores that I mentioned earlier, the POEM and the DFI. That's happening as early as week 1 in this sub-analysis and is continued all the way through week 8. These findings demonstrate early and sustained improvement in sleep scores and skin symptoms throughout the study in children's down to age 2 with use of once-a-day VTAMA. That's an interesting new thing for us as clinicians. We are having a shift in our treatment paradigms. Previously, we were using predominantly topical steroids and some topical calcineurin inhibitors as our primary treatment. This has been a paradigm shift to have new non-steroidals like once-a-day VTAMA in our arsenal. It is a safety issue with patients having a treatment that's well tolerated. And then for these folks in our sub-analysis, having improvement in sleep disturbances and having an option other than previous standard therapies, which is an alternative approach that is both safe and avoid some of the potential risks that we see with the other previous standards of care, the topical steroids with some of their side effects, and TCIs with their previous black box warnings that may have made those therapies less attractive to patients and their caregivers. Yeah, so I think a lot of the pediatricians are very comfortable handling mild to moderate eczema themselves. I think that as a subspecialist, we have a couple of advantages. You know, as an allergist myself, I'm able to do allergy skin testing. I have time built into my day where I can talk about and assess some of these quality of life measures like the POEM score and the DFI in my clinic. The busy pediatricians are doing so much else in the course of a visit that they don't have that luxury of time that I get in my office. But it is helpful for the pediatricians to be able to assess the invisible signs of disease and the disease burden that that places on the family, and signs that may warrant further changes in therapy or referral on to someone like me are persistent sleep disturbances, behavior changes, the negative impacts of those diseases on the family, all of that, or just recalcitrant to previous therapies tried. All of that warrants further investigation with a subspecialist, and I think we have some ability to impact there. But I think our pediatricians are doing a lot of the heavy lifting in their own clinics. Right. So I think that this new sub-analysis provides a new set of findings that help the pediatrician set very realistic and encouraging expectations. We can be telling parents and the patients that they will be seeing improvement in sleep scores, or sleep quality as early as week one, and that improvement continues on through week 8 and is sustained during that time. That is with once a day VTAMA in children 2 and up. So it's across all ages with a once a day therapy. So it is very nice to have a treatment that is easy and we can see early and sustained responsiveness too. I like to be talking about setting expectations in my office when I'm seeing these patients so that they know what we're going to be seeing. Our previous sub-analysis showed improvement in itch scores as early as week 1. This new sub-analysis correlates that in conjunction with sleep. And so I think being able to say by week 1, we're seeing itch improve, we're seeing sleep quality improve, that we can set their expectations for once a day VTAMA and how it's going to change and modify their life. Also, the VTAMA in the sub-analysis showed consistent tolerability and consistent safety profiles with previous studies. So you can talk about the benefit as well as tolerability, which are important things for our families. So I'd like to reiterate the fact that VTAMA once a day, we are seeing sleep scores improve with our POEM and our DFI by week 1 in our patients 2 and up, that improvement is continued through week 8, is sustainable. The tolerability and safety profile within this sub-analysis did not change, and that this is a therapy with once a day for age 2 and up, that patients and their caregivers can see improvement in their atopic dermatitis. The sleep disturbance for children with atopic dermatitis and their families is a struggle. And so having that change and affect their lives is a huge thing. And we as clinicians can help our families see that invisible burden improve. It's not just the skin clearance and improvement of the eczema, it's the impacts that the disease has beyond those visible things to the invisible, that I think is an important note from this sub-analysis.